Acute pain, nursing interventions. The videos of Swot nurse notes serve as worded explanations and for demonstration purposes only. These notes are based on the owner of the channel's understanding. The channel's purpose is to assist with studying and to help with adapting to the UK clinical setting. These notes are short and simple for persons to better have a foundation knowledge to build on. This, however, does not serve as a specific guide to the NMC OSCE and CBT exams. Hey everyone! I'm Nurse Swot, the owner of the channel. Let's revise the nursing interventions for the nursing diagnosis, acute pain. After thorough assessment, there are needs that will be identified that requires nursing interventions. These can be identified as physical, psychosocial, spiritual, or sexual. Always attend to the priority need first. For the OSCE exams, you are expected to identify 2 relevant nursing problems or needs. Set the aims and appropriate evaluation date for the 2 problems identified, and ensure that the nursing interventions are current-based. Do you know about the mnemonic? EMATARID? EMATARID? I will explain more about this further on in the video. Here is an example of nursing interventions for the nursing problem, acute pain. 1. Explain, discuss, and gain consent for all aspect of care. Remember to write the name of the client or patient on the care plan. Care plans should be easily identified as to who it belongs to. 2. Monitor and record vital signs and escalate as per News 2 policy. Please note carefully that I have X hourly in brackets. This is because the monitoring frequency for the vital signs will be based on the total News 2 score. Whether it is 1 hourly, 4 to 6 hourly, etc. 3. Assess pain level using the 0 to 10 numeric pain assessment tool. I will mention more about this in the video. 4. Teach relaxation techniques such as deep breathing exercises and repositioning techniques for comfort. 5. Administer prescribed analgesics medication and monitor for effectiveness after 30 minutes. Remember to revise the onset and duration for common medications. Examples for the drug class: analgesics, antibiotics, antidiabetics, antihypertensive, NSAIDs, etc. This is because the monitoring for effectiveness timeframe written on the care plan should be realistic with the onset timeframe of the drug given. 6. Perform nursing care during the peak effect of analgesics. 7. Refer to the pain management team. Remember that the department, unit, or team being referred to should be linked to the nursing problems identified. 8. Inform on the use of diversional activities such as reading, watching TV or mobile videos, and playing mobile games, to alter the psychological responses to pain, thus providing comfort. 9. Document all aspects of care. Why? If it's not documented, care was not done. For the assessment of pain, use the nursing mnemonic PQRST as a guide. 1. Provoking factors: what makes the pain better or worse? Walking, bending, laying down, etc. 2. Quality. Describe the characteristics of the pain. Ask, what exactly does the pain feel like? Is it sharp, throbbing, dull, or stabbing? 3. Region. This is linked to the location of the pain. Can you show me where the pain is? Where exactly are you feeling the pain? 4. Severity. This is where you would ask the person to rate the pain by using different pain rating methods. Examples: pain scale of 1 to 10, Wong-Baker-Faces scale, etc. 5. Temporal. Refers to the onset, duration, and frequency of the pain. Ask, does it occur all the time or does it come and go? Frequency. How long does it last? Duration. When does it start? Onset. As mentioned previously, the 0 to 10 numerical pain rating scale is one of the tools used for pain assessment. The scores for this tool are interpreted as follows: 0, relaxed and comfortable; 1 to 3, mild discomfort; 4 to 6, moderate pain; 7 to 9, severe or intense pain; 10, extreme or worst pain possible. What are some of the medications that can be given for pain? Well, at times you will administer nonsteroidal anti-inflammatory drugs, NSAIDs, as ordered. NSAIDs are effective in managing mild to moderate pain. NSAIDs has analgesic, anti-inflammatory, and antipyretic effects. Examples: ibuprofen, naproxen, diclofenac, aspirin, oxyprocin, atodolac, and indomethacin, Indocin. Opioids can also be administered for pain. Opioids are given when other pain medications fails and/or if the pain becomes severe. Examples: codeine, hydrocodone, and tramadol, Ultram. These are given for moderate pain. Morphine, hydromorphone, oxycodone, methadone, and fentanyl are given for severe pain. Most of these drugs are controlled substances due to the potential of being misuse. For the OSCE exam, the drug paracetamol. In adults, before administering, check when it was previously given. Note the duration for paracetamol is 4 to 6 hours. Onset orally, 30 minutes, and onset intravenous infusion, 5 to 10 minutes. Persons with body weight under 50 kilograms should not be given 1 gram of paracetamol. Please pay keen attention to the weight given in the exam scenarios. Now, why can't a person with a body weight under 50 kilograms take 1 gram of paracetamol? The answer is, those with a body weight under 50 kilograms are at increased risk of experiencing paracetamol toxicity, and they may have other conditions which may predispose them to liver damage. The mnemonic EMATARID. Ematarid, as mentioned earlier in the video, is a guide that is used when writing nursing interventions for your care plans. Using this mnemonic will help to secure your marks for the care plans you have written in the exams. Let's begin. E. E means to explain. Explain, discuss, and gain consent for all aspects of care with the patient or client. A patient or client should not consent to anything unless a clear explanation was given. This is the first intervention that should be written. M. M means to monitor. What are you going to monitor for the patient or client? Example: monitor and record vital signs and escalate as per News 2 policy, or monitor and record patient or client Glasgow coma score. Please remember the frequency of monitoring for the vital signs are based on the total News 2 score. Whether it is 1 hourly, 4 to 6 hourly, etc. A. A means to assess or assist. What are you going to assess? Or what are you going to assist with? Here are examples as to what you could assess. 1. Assess pain using the pain assessment tool. 2. Assess level of consciousness. 3. Assess nutritional intake. 4. Assess cranial nerves. 5. Assess mental status using PHQ-9 or 6 CIT. 6. Assess respiratory status, signs of distress. 7. Assess blood glucose levels. 8. Assess for signs of bleeding, etc. Here are examples as to what you could assist with. 1. Assist with activities of daily living such as bathing, feeding, and toileting. 2. Assist with ambulation. 3. Assist with repositioning, etc. T. T means to teach. What are you going to teach the patient? Some examples are: 1. Deep breathing exercise. 2. Pain relief techniques. 3. Splinting of surgical wound site. 4. Wound care practices, etc. A. A means to administer. What are you going to administer? The prescribed medication based on the nursing problem or need identified. The class of the drug can be written as to what will be given. For example, if the patient has an infection, antibiotics will be given. If experiencing pain, analgesic will be given. Remember to state the time frame to monitor the effectiveness of the class of drug given. Example analgesics. The onset is 30 minutes. So you would return to the patient or client after 30 minutes to confirm effectiveness. R means to refer. Who and where are you going to refer the patient or client? Based on the need or nursing problem identified? Is it the diabetic nurse? Cardiology team? Pain management team? Nutritionist, etc. I means to instruct or inform. You can instruct the patient to use the call bell, a remote device that signals nurses or staff members at the nurse's station of the need for help. What can I inform the patient or client about? 1. Diversional activities. 2. Importance of blood glucose daily checks. 3. Healthy lifestyle practices, etc. D means to document all aspects of care. Remember, if it's not documented, it's not done. This is the last intervention. For the OSCE exams, uses professional terminology in care planning. Do not use abbreviations or acronyms. If an error occurs while writing the care plan, ensure one strike-through is done and retains legibility. Write your forename and surname, date, and affix signature at the end of each care plan written. Remember, the planning station is for 14 minutes. Thank you for watching. Remember to like, share, and subscribe to channel.